What are the common signs and symptoms of successful implantation?
In this video, we'll discuss the common signs and symptoms of successful implantation, which is a critical step in the early stages of pregnancy. Implantation occurs when the fertilized egg attaches itself to the lining of the uterus. Knowing the signs of successful implantation can help you determine if you may be pregnant. So, let's dive into the topic.
What is implantation bleeding?
Implantation bleeding is one of the earliest and most common signs of successful implantation. It usually occurs about 6 to 12 days after ovulation and fertilization. The bleeding is typically light pink or brown in color and lasts for a short period of time, often just a day or two. It's important to note that implantation bleeding is different from menstrual bleeding, which is usually heavier and lasts longer.
What are the changes in basal body temperature?
Another sign of successful implantation is a slight increase in basal body temperature, BBT. This is the lowest temperature your body reaches at rest. After ovulation, the BBT rises slightly and remains elevated if implantation is successful. Tracking your BBT can help you identify potential signs of implantation, but it's not a foolproof method, as many factors can influence BBT.
What are the other common symptoms of implantation?
Apart from implantation bleeding and changes in BBT, there are several other symptoms that may indicate successful implantation. These include 1. Mild cramping. Similar to menstrual cramps, mild cramping can occur as the fertilized egg attaches to the uterine lining. This is usually felt in the lower abdomen. 2. Breast tenderness. Hormonal changes can cause breasts to feel tender, swollen, or sore after successful implantation. 3. Fatigue. Increased levels of the hormone progesterone can cause tiredness and fatigue during early pregnancy. 4. Nausea. Some women experience mild nausea, also known as morning sickness, as early as the first few weeks of pregnancy. 5. Increased sensitivity to smell. Hormonal changes can make certain smells more potent or unpleasant during early pregnancy. In summary, successful implantation can be indicated by symptoms such as implantation bleeding, changes in basal body temperature, mild cramping, breast tenderness, fatigue, nausea, and increased sensitivity to smell. However, it's important to note that these symptoms may not be experienced by all women, and they can also be associated with other conditions. If you suspect you may be pregnant, it's always best to take a pregnancy test and consult with a healthcare professional for confirmation.